COVID cases are on the rise, but is that because of more testing or more spread? Investigative reporter Angie Ricono asked local hospitals, how many patients are you admitting? It's a pretty simple question, but getting an answer isn't so easy.
We picked 10 hospitals and we picked them on both sides of the state line because we wanted to cut through everything, right? And here's what we asked. How many people were hospitalized for the coronavirus this Tuesday? What did it look like 1 week ago? And what about the previous months? Can you give us some daily averages so we can see what's going on?
I think anytime we see an increase in numbers, we're concerned.
Meet Dr. David Wild. He carefully tracks COVID-19 numbers inside the University of Kansas Hospital. All hospitals are required to do this, and the reason is simple.
That's the primary stress on the healthcare delivery system.
Here's what average patient admission rates looked like at KU for the months of April, May, and June. Last Tuesday, there were 24 COVID patients. This Tuesday, it was 36. July is clearly up.
The increase in cases is not solely due to new testing, it's due to increased spread across our community.
Other hospitals we contacted easily provided similar data and agreed with Dr. Wild that they are seeing a surge inside hospitals. Here's the data from Advent, and you can see the daily average for the previous months. And then last Tuesday and this Tuesday, 23 patients. Truman Lakewood provided the same information. Daily averages in the sevens for April and May. It increased in June. July looks like it will outpace previous months. Last Tuesday, there were 29 patients, and this Tuesday, there were 34 patients. St. Luke's had a higher daily average of patients in April than May and June, and you can see the daily average. Last Tuesday, there were 46 patients, and this Tuesday, there were 71.
This is the VA.
The VA did not answer our questions, but did direct us to a website which shows total cases,
238
active cases, and deaths across the nation. It breaks it down by hospital. 6 people have died. There are 61 active cases. But other hospitals, for whatever reason, have a different approach to collecting and sharing similar information. North Kansas City Hospital, we aren't releasing hospital-specific data. HCA, which is Centerpoint and Overland Park Regional, sent this response. Due to the ongoing and ever-changing nature of this pandemic, we are unable to respond to the specific information you are requesting. The email suggested we turn to other gatekeepers of information.
We don't have anything.
That turned out to be a disappointing suggestion.
Here's hospitalization.
Johnson County keeps data, but if you look at hospitalizations, the information abruptly ends.
We appreciate your patience while we investigate new sources. Yesterday,
Kudos to Wyandotte County.
updated, 1 p.m.
They provide a clear number.
36 hospitalized.
The Missouri Hospital Association breaks it down by regions.
So you can see it's going up and down, but it's trending up, but it's also dated.
The website explains, due to the abrupt change in data measures and the reporting platform issued by the White House, situational awareness will be limited.
There are definitely some questions and concerns about that process.
Many doctors and hospital systems are now sharing information among themselves and mostly with the public. The reason is simple. Information in a pandemic is important.
So to answer our original question, what's going on inside hospitals, it's clear that the number of patients is increasing, but there is some good news ahead. Doctors talk about those mask mandates, and that could change things, but it will take some time before we see results. In Kansas City, Angie Ricono, KCTV5 News.